I would like to assess one of my students' letters today and provide the feedback. Let's go through the letter. So you have written on Dr. Collins. Is that the only name given for the patient, Asha?
Yes, sir.
Okay. Hospital psychologist. Okay. See, hospital and psychologist need to go together in one line itself. So don't write hospital and then in the next line psychologist. That's wrong. And what you should have done, there is another issue as well. You have to add the hospital, sorry, hospital, and then psychologist. Okay, in one line itself. Write the designation. Write the designation in one line itself. Okay. Do not split it in two lines. It's not good. It's not recommended. Let's go to the next one. You have written on the date 27 March 2005. I'm happy with that. And then that's a reference details regarding Miss Alice Anderson, aged 20. So I'm happy with the way that you have written down. That's good. And then dear doctor, that's fine. Comma, that's good. I'm writing to refer to Miss Alice Anderson. You don't need to write down the full name once again, because you have already mentioned the full name of the patient here. So you can just mention Miss Anderson. That's it. It's okay. Fine. So you should have mentioned. Okay. So if that is Miss, if they have given Miss already, then you have to use Alice only. So that's fine. So what you could have done is, so instead of writing down Miss Alice Anderson, you should have mentioned Miss Alice only. That's it. So write down, the first name, or I mean, the full name of the patient once only. That's it. After that, you shouldn't write it down fully. Who was admitted to our hospital after unexpected death of her mother? Okay. All right. So in this case, you don't need to use a comma here, because you're not adding, additional information. So after Miss, or of before who was admitted, you can remove this comma, please. Remove this comma, please. Okay. All right. Let me go to the next one. Okay. Who was admitted to a hospital after unexpected death of her mother. Okay. So this the way you are writing down this U seems to be a capital U. Okay, so it's better not to write it down. You have to write down like this. Okay, instead of writing down unexpected like this, you have to write down small u. Do you know what is small u? This is how you need to write down. So there is a difference between small u and capital U. Okay. All right, let me go to the next one. What's the next one? Okay. Admitted to a hospital. Okay, she requires your care and support. That's good. So apart from these minor mistakes, your introduction paragraph sounds good to me. I'm happy with that. Okay. Miss Anderson, yeah, Miss Anderson is a student. But when they use Miss, you have to write down, the first name only. That is an exception actually. So Miss Alice, don't write Miss Anderson. If they have given Miss, okay, particularly, so you have to write down Alice only, not the surname of the patient. No, that's wrong. So Miss Anderson is wrong actually. That's one of the exceptions you have to be mindful about. Miss Anderson, Miss Alice, okay. Anderson's mother committed suicide after suffering from pancreatic cancer on 27 March. Okay. All right. Let's say if she has committed the suicide, you have to mention the date after committed suicide. So you have to write down this one on 27 March here,
Mm-hmm.
before, after suffering from. Okay. So 27 March. Okay. Let me say, what do you have to do? Committed suicide. Okay. All right. Suicide. So you have to say suicide on 27 March 2005. Is that 2005?
Yes, sir.
Yeah, okay, 27 March 2005. And the M must be in capital letter. So the way you have written down is wrong. You have written down like a small m. That's not correct, okay? So you have to write like this: suicide on, and then after suffering from, okay? After suffering from, let's say after suffering from. It's better to use formal phrases. For example, after experiencing. Instead of using after suffering from, you can say after experiencing pancreatic cancer. By leaping from the upper floor of hospital. See the F, the way you write this F. Look at these things. These two F sounds like capital F. So you're writing down like this: floor off. This is wrong. This is not good. You have to write down small f only for both of them. Floor off. Small f in both words, okay? After
Mm-hmm.
leaping from the upper floor of hospital. Her mother was diagnosed with pancreatic, okay, pancreas carcinoma 8 months ago, which was worsened last month. Okay, which was worsened last month. Okay, all right, and caused metasto. Can you please tell this? I couldn't read this word. Sorry.
Metastasis of liver.
Statistics. Okay, okay, all right.
Mhm.
Of life.
Of liver.
Oh, liver. Okay, yeah, it's a liver.
Yeah,
R.
my
Okay,
handwriting
it
is so
sounds like
tough.
a, yeah, comma or something. All right, no worries.
That's
Yeah.
R.
So therefore, Miss Alice is keep declining. Okay, to talk. No, 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 that's wrong. Remember this with the verb. Okay, you can't use like this. Keep. Okay, so
Mhm.
what you can do is that it's like keep declining to talk with the nurses, okay, and sisters, okay, all right. Okay, so Miss Alice is keep declining. Miss Alice um, didn't show interest, okay, didn't show interest or was not willing, okay. You can also say Miss Alice is not, or if it is the present tense, you can say it doesn't show, or if it happened in the past tense, you can use didn't show, okay. Mr. Alice is unwilling or is not willing, okay. Talk with, okay, talk always goes with the to, talk to,
Oh,
and then speak always goes with the with, speak with, either talk to or speak with. That's the correct way of writing down the prepositions, okay. So where is that? Sorry, it's here. I think no, it's somewhere here. Oh yeah, declining to talk with the nurses and sisters. Also refusing to take her foods. Okay. Also refusing. When you use also refusing, you can say and also refusing. That's okay. To eat foods. To take food. That's all right. Take a food. Yeah, that's okay. However, she only accept, okay, with the she, okay, she only accept, okay, this is wrong. She only accepts. Why she needs to go with the verb? She is the third form of the singular noun which goes only with the verb plus s in the present tense. So you have to write down she only accepts. She only accept is incorrect. She only accepts to drink some soft drinks. Okay, instead of saying to drink some soft drinks, to drink some soft drinks, you can say to have some soft drinks. Okay. It would be greatly appreciated. The letters, P and A and O seem to be the same. Look at this. It doesn't look like A. So please clearly state A. All right. A means it needs to start like this and then go like this. Don't just use it like O. Okay. It would be greatly appreciated if you could provide appropriate care for Miss Anderson. It's not Miss Anderson, it's Miss Alice. It's going to be Miss Alice. All right, that's the one. And then to improve her condition, that's all right. Importantly, there should be a comma. That's right. She is having her final exam. See, again, this F, final exams. Okay, all right. Let's say capital F, final exams. This is wrong. Final examinations. You need to always expand the abbreviation. Expand the abbreviations, please. Never ever use abbreviations in your letter. It's not recommended at all. Okay, you have to expand all the words after 3 weeks. That's okay. Again, like it doesn't look a. Okay, please do not hesitate to contact me if you have any questions. That's all good. You are sincerely registered nurse. Okay, I'm happy with that. All right. Let me give you the assessment now. So grammar is one of the areas of concern. You have to improve your grammar, okay? Particularly use of nouns, verbs, punctuation marks, articles, and prepositions could have been better. All right. And then what else? Okay. Please do not change the name of the patient regularly. You should not do that. Okay, it's not good. All right. And use always expand the abbreviations. Never ever use abbreviations at all. No, you should not do that. Use the prepositions correctly. So talk with is wrong. Talk to and then speak with. Okay. And the handwriting needs to be improved. Handwriting needs to be improved a bit because your handwriting is not clear. Okay, when the examiner is going to go through your letter, he or she will find it some problems to understand that. And then yes, and then use of capital letters and small letters could have been better. Use of capital and small letters could have been better. All right. Case notes were well organized. I'm happy with that. The way you have organized is okay. Well done. Overall task fulfillment could have been better. What else? Vocabulary is another problem area. Okay, you have to use formal words only. Try not to use the informal phrases. And layout and presentation features are fair enough. Okay, I'm happy with that. Presentation features are fair enough. Connectivity is okay. I'm happy with your connectivity as well. Let me give you the expected score. To me, this sounds like, let me go through the errors now and then their severity. So Changing the name is not good. Using the punctuation marks is not good. Capital letters, small letters, no. And then the way you have placed the order of words isn't up to the mark. And then the way you have written on the capital letters and small letters could have been much better. Yeah. Apart from that, it's not that bad. Okay, to me, this sounds like a 280 out of 500 grade letter. Okay. I wish you good luck with your next letter. If you don't mind, could you please proofread the next letter and then send it to me once again? If you can rectify at least some of the mistakes, I would be very happy, Asha.
Yes, sir. I will do
Thank you
that.
so much.